How's everybody doing today? Appreciate you guys taking your time this Wednesday afternoon or morning, whatever time zone you're joining in from. Hopefully, you guys are looking forward to a little HIPAA compliance talk. As you can see, today's all about the small practice. We're going to go through those requirements, but we're going to make it specifically for small practices, their needs. And so, again, I really thank you guys for joining me. My name's Bradley King. I'm a compliance consultant here for Abide. If you don't know who Abide is, we're an industry leader when it comes to HIPAA compliance and education, and we're thrilled to be with you guys here today. My goal for today is so you guys gain valuable insight to the state of HIPAA through the webinar and really take away some actionable items you guys can implement for your practice or business. As there's never been a better time to make HIPAA a priority, I'm sure, as you know. As I mentioned, at Abide, we are a technology company based out of Tampa, Florida, to give you some background, made of industry and compliance experts that provide education and solutions all around the country. That's actually one of the main reasons why we have partnered with HIPAA Journal to put on this webinar. They've also entrusted us and partnered with Abide because we've been through over 250 audits and investigations with our practices. And none of those audits that we've been through with a business or a practice has resulted in any type of fine, failure, or breach. And so we hope you're able to trust us and exactly what we're saying. And that's why we've also been entrusted by so many other state organizations and partners nationwide. Let's now jump into today's agenda. And as I go through this webinar today, if you guys have questions, I'm going to do my best, if there's time at the end, to look at the questions, answer any questions you have. If not, I will also share my email, and I'll get back to each one of you guys with any specific questions you have about your practice or your business. But now let's jump back into the agenda. First and foremost, what we're going to do, we're going to talk about the state of HIPAA, covering the triggers, complaints, fines. We're also going to take a deep dive into the safe harbor law, what that looks like. Then we'll walk through really the path to compliance, what it looks like in the eyes of the government when it comes to breaking down the privacy and security rule, really just in plain language. What do you need to do? Make it simple. And then go through some government initiatives, what an audit letter looks like again. And then, of course, if we have some time, answer any questions you guys have for me here today. So I'm sure there's a lot out there. As I jump into this next slide, I think it's a good idea for everybody. I want everybody to think of, what does the HIPAA acronym stands for? Does anybody know? I'll even give 10 seconds to see if somebody wants to be brave and type it in the chat. Because it's a really, really big area where people already get confused. And so what it stands for Health Insurance Portability and Accountability Act. We bring this up because it's an acronym that really has nothing to do with what your practice needs to be HIPAA compliant. And again, it's actually a great example to show how confusing it can be. On the bottom here, what those regulations include, a lot of legalese. And I'm not here to give you guys a huge boring history lesson, not my goal. I want you guys to pay attention today, take something out of this, like I mentioned, that you can proactively implement at your office. But this is a good place to start. And what has changed? What does it look like in regards to the government with HIPAA? As I'm sure a lot of you guys know, HIPAA has been around for a while, since 1996. Now enforcement caught up with those regulations in 2013 onward, and that's where we've seen pretty hefty fines, which we'll touch on here in a moment. And then second, the HIPAA law isn't some old regulation nobody really cares about. It's an active changing thing. Just this past February, covered entities were required to update their notice of privacy practices to reflect those new rules around substance use disorder. And that actually applies a lot more broader than people may think. If you guys pull or touch any type of information through referrals or other practices, that's something you're going to want to implement in your notice of privacy practices as well. And so if you're already thinking about the last time you updated your notice of privacy practice, if it doesn't say February 2016 or later on there, probably should go look into that. And then last but not least, something that's changed in the last few weeks, just looking ahead, is those proposed new security rule updates. We're expecting them to be finalized a couple months ago, but they actually just pushed the rule out. But we'll touch more on that later down the line today. And so really a big takeaway for you guys here is focusing on that last word in regards to HIPAA is act. What is the government looking for? What is enforcement looking for from you guys? Provide action. Are you being proactive or are you being reactive to situations? They're looking for proactive action from you guys. And so what we're going to do now is really cover the current state of HIPAA, what you need to know based on what we've seen over the last few years. And that starts with enforcement. Who enforces the law? And that really breaks down into three main categories. First and foremost, you have the CMS, Center for Medicare and Medicaid Services. You have the OCR, the Office of Civil Rights. And I don't know if you guys noticed on that last slide, if you didn't, as of 2018, they have now authorized your state attorney generals to actually get into the action in regards to enforcement. And I always like to joke around on these webinars. There's really a fourth agency. It's the Silver Court, aka your patients. They're watching, whether we like it or not. They're watching you guys. They're seeing what you do, how you handle their information. Especially, ever since COVID happened, a lot more people are educated on what HIPAA is, what the laws are, whether they think they're right, whether they are right, or whether they're wrong. Not going to matter. They are watching. But now, however, most of these enforcements and fines came from the OCR. And why they'd happen, again, this is focused to private practices. I meet with dozens of private practices every week. I've met with thousands and thousands of private practices, from solo practitioners to 5 employees to 5 locations with 55 employees to enterprise locations. Main question I get in regards to private practices, hey, Brad, we've been open for 5, 10, 15, 20 years. We've never seen anything. We've never heard anything. Does it even matter? It does. As I mentioned, we've been through over 250 audits and investigations with our practices. They happen almost, and breaches happen weekly. And so the 3 most common triggers for those enforcements are, number 1 is the government's audit program. Number 2 is patient complaints. And then, of course, breaches. Each of these we think of as like investigative triggers. In other words, reasons the government will come knocking on your door. But getting that knock nowadays is not really a matter of if, more of a when. And once they knock on that door and get in that front door, just because of what happened, whether it was breach, audit, or a patient complaint, now it gives them access to the full HIPAA program to cross-check everything you guys have in place. In regards to some trending topics we've seen, I want to very quickly, so we stay on track on time today, just touch through a few of them, starting with Google reviews. Be smart. Before I meet with every practice, I look at the Google reviews and I'm shocked daily about how people respond. Do not share patient information. Do not use any type of PHI in regards to responding to reviews. Look back on your HIPAA Google response policy on how to handle things. And then if you guys use Google reviews on your website, reach out. Are those patients signing media consent forms before you use the reviews on your website? If not, make sure you check on that and make sure they're all getting those signed for you guys, so you have permission. And then we have breaches. When you think of breaches, you think of hacking events, IT incidents, and that is the leading cause for breaches. But you also have a lot more out there that you may not think of, as simple as losing something, somebody breaking in and stealing a computer, unauthorized access, and there's a lot more out there. We've seen a whole bunch of things happen. And so a breach is not just a cyber event or a hacking event. It can be a cause of a lot more different areas. Now jumping into a little newer topic, the OCR Risk Analysis Initiative. This is something that the OCR really is focusing on. Why is because they've realized there's a major gap in regards to practices and who can and who cannot show a completed risk analysis. They're looking for you guys to complete a full, thorough, in-depth analysis of the business, and we'll jump into at the end of today exactly how to complete a full risk assessment. And how we know they're focusing on this initiative is in 2021, the OCR was getting pretty busy with 5 fines in one day. That was a record-breaking amount until they outdone themselves in 2022 with 11 fines. And as we go through each and every year, we continue to see a rise in them looking for that risk assessment, because the last time and the numbers we see they did their audit program, 86% of covered entities could not show a full in-depth risk assessment, which is a scary number because we're all patients somewhere. There's a practice out there that's holding our information, and we want to make sure they're following the right procedures to make sure that can't get breached in any area of the practice. Now let's jump into a little more of a updated information. Where is HIPAA headed? In December of 2024, the OCR released proposed new updates to that security rule, the most significant one in over 20 years. The proposed rule would make the current recommended cybersecurity safeguards mandatory with things like multi-factor authentication, mandating real-time asset inventory, encrypted email services, so on and so forth. Now, it would also require your business associates to be certified annually by cyber experts, notify practices within 24 hours of a breach. But now the important part is it's not an actual law yet. And the timeline actually keeps slipping a little bit. It was originally expected to be signed sometime this year. We thought in May, but now the HHS has now pushed it into 2027. That doesn't mean we can relax and not worry about HIPAA. There's still laws out there. The current security rule is still in full effect. The OCR is not slowing down. If you look on hhs.gov and look at the fines, you'll realize that pretty quickly. Just last year, they've resolved 21 settlements, the second highest on record, just for missing or an incomplete risk assessment. And so it's still the number one thing that practices get fined on. And so the message is pretty simple. Don't wait for the new rule. There's already exposure that exists. Implement something now. Be proactive about it, as the fines are not light. As you can see, there's a trend. It's not fleeting. It's not going away. It's becoming more mainstream. And in all honesty, when the government strikes for oil, what are they going to continue to do? They're going to continue to strike. Now, comparing 2021 fines to 2025 fines. As you can see here, cyber events leading cause, down to patient right of access and patient complaints. To what we saw last year, you'll notice the pictures changed a little bit. Now, cyber events are still the leading cause, but it's dropped from 85% down to 77%. And so it's still a big risk, but it's no longer the whole picture, the whole story. What's new? Malicious insider now, with employees taking your patient's records and information and using it. Not permissible disclosure also has jumped to 9%. So making sure you guys are handling all your information the right way. And then, of course, patient right of access did drop down from 14% to 4%, but people are still getting fined for not giving their patients their own records, which is crazy, which we'll talk about here in a second as well. But a lot of this stuff can be avoided with just doing the right things. But if you don't, as you can see, it's something that is very, very relevant. Fines are almost at its peak. There was over $10 million in fines over the last year and a half. The average fine for a business or practice was over $350,000, which is not a slap on the wrist. And again, they don't care about the size of the organization. If any business or practice handles patient records, that's just as important as the next. Now, they may have 10,000 records versus a practice having 150 records or 1,500 records, but Johnny's information and Jessica's information is still their own information, and it needs to be held to the highest standard. Now, enough of that bad news. Let's get into something that's good. You can take a deep breath. It's called the HIPAA Safe Harbor Law. It may not be earth-shattering, but under the HIPAA Safe Harbor Law, the government actually passed a bipartisan bill to encourage covered entities to implement standards that meet federal and state requirements. In turn, they're going to get reduced penalties for incidents like data breaches or patient complaints, if those ever happen. This is really an amendment to the HITECH Act, which governs healthcare information and technology, which passed January 5th of 2021. It's an incentivized program that really is just looking for you guys to meet basic security measures, especially with growing cyber threats that a lot of businesses and practices face today with the vendors you use. They want you to comply with the HIPAA security rule, meet appropriate technical safeguards, and if you can do that and walk through all these aspects and have it documented for at least 12 months prior to any HIPAA incident, like a patient complaint, data breach, audit, the Office of Civil Rights is actually going to reduce fines and cut short any HIPAA audits. And from what we've been through with practices, it's exactly what's happened. The problem is jumping back to that percentage I talked about earlier with that security risk analysis. If you're part of that 86% of practices that cannot provide that, then you don't qualify for this initiative, for this law. And so that's something that we really, really highly recommend taking advantage of. And so before jumping into the steps of HIPAA compliance and making sure you can take advantage of that safe harbor law, if I can talk today, there's no wrong answer here. But just think to yourself, how do you guys define being HIPAA compliant at your practice? What do you guys do on a, weekly, monthly, yearly basis when it comes to maintaining HIPAA? Have you done it yearly? Has it been 10 years? Take out those binders that you guys have in place, those dust collectors, because we're going to break down exactly what should be in place moving forward. And so here at Abide, this is our definition of what we say we think it means to be HIPAA compliant, and it's that documented proof that there's a culture of compliance within your organization. And that culture should really weave itself in and out of every aspect of your practice. As we've worked with thousands and thousands of private practices around the country, we also understand that documentation piece is usually what falls in between the cracks a bit, mainly because it's just confusing to know what to document in the first place. As I'm sure most of the HIPAA compliance officers at the businesses are either the owner, the doctor, an office manager, administrator, or this isn't your only job you're doing each and every year. You're usually wearing 100 hats a day. And so when it comes to updating, your HIPAA policies and your risk assessment, usually just doesn't get done. But we want to make sure that moving forward, there's an action plan, there's a game plan, so that you guys can actually maintain that on a year-to-year basis, because it's super important. And so documenting a full HIPAA compliance program, we like to break down kind of like a puzzle picture. It really breaks into two main parts. First, you have that security rule with that security risk analysis, followed by the privacy rule, mitigating all those risks when it comes to protected health information, as HIPAA is not a one and done thing, but an ongoing process. So let's jump into this first puzzle piece. And as I go through the security risk analysis, think to yourself, look in your HIPAA binder. When's the last time we completed a risk analysis? Is it just a general checklist where it took us 20 minutes to do? If you do this in-house and you have that checklist, it's a full day process. It's not easy, it's hard. And then if you have multiple locations, has this been done specifically for each of those locations? Because I want you guys to know, if you don't have this first puzzle piece, you and the government really can't move forward in the rest of any type of investigation, audit, or to the rest of those puzzle pieces. Through most of the audits and investigations we've been through, this is the number one thing that's asked for just about every time before anything else. And again, they usually don't move on until you can provide this to them. And so in layman's terms, really what this is, it's going to be a self-evaluation of your practice, where you're breaking down your physical, your technical, and your administrative safeguards, and you're identifying what you've been able to implement, which is fairly easy to do. I'm sure you all know exactly what you've been able to implement in your practice. The problem is, once you identify those safeguards, you now want to identify the high risk areas you have, the whole point of that risk assessment. And that's usually where it starts to present a problem, especially for small and mid-sized practice environments, because you're not HIPAA experts. You don't have the time, energy, or knowledge to make sure everything's getting done accurately and thoroughly enough. But at the end of the day, it still has to get done one way or another, because it is a requirement. And so again, this is breaking down your full location, your business, not only with EPHI and your computers, but your physical areas, your administrative areas, it could be as simple as, hey, if we don't wiggle the front desk mouse in 5 minutes, does it automatically shut off? Do we have screen protectors? Do we lock our cabinets that hold PHI in the back? Do we have security cameras? Who has access to the alarms codes? Do those alarm codes change? So on and so forth. I won't keep going, but those are some examples of some questions you'll go through in that risk assessment. Now, once that risk assessment's done, we then move on to that risk mitigation. Step 1, flag all those medium and high risk areas. Step 2 is now to create an action plan throughout the quarters and years moving forward to fix those areas. And as you fix items, make sure you're going back in that assessment and documenting what you've been able to change. Just tell a story about what you guys are doing to protect your patient records. Training. Hopefully we all do this. This is an important piece, but again, it's not the only piece to HIPAA and being compliant. With this, it should be done minimum once a year. Best practice and our recommendation is that conduct it with like a training module on a pass-fail basis, so you can show who comprehended it, who didn't comprehend it. And we also recommend all new employees should be trained within the first 30 days of coming on board, but really day one, they should just be trained, get that certificate time-stamped that they did it day one, documented it, so it's there to protect you guys. Now jumping into some policies and procedures. This is a big one here. When it comes to policies and procedures, these must, and I mean must, be drafted specifically for you guys' practice, because it should be identifying exactly how your organization addresses the security and privacy on how you guys handle your patient records. These are vital in case of any audit you go through. Because think of HIPAA again like taxes. We've never been through an audit or investigation where there's HIPAA police that shows up at your front door and walks around and sees what you do. We've just never seen it. Usually it's through mail, email, or it starts with an investigation and a phone call. And so what these policies are, essentially like your W-2s, your 1099, you're supporting documentation if something happens, just like a tax audit. The IRS wants to see that additional proof of that tax return. Same with HIPAA. These policies and procedures should be prescribing line by line your setup with your practice. Depending on if you have a cloud-based solution versus hard drives versus paper records versus you have an encrypted email service or not. How are you onboarding staff members? So there should anywhere from 30 to 40 policies in there. And then make them specific for your state laws. If you're in Texas or California versus Virginia and New York, all of your policies, there's a lot of policies in there that are going to have different numbers in there on how you can, when you need to provide patients their records and information. And so make sure you're meeting with somebody that can go through all that stuff with you. It's not a binder that's been sitting in a closet for the last 3 or 5 years that you're like, oh, we paid money for something. It makes us HIPAA compliant. Unfortunately, it's not that easy. A lot of people wish it was, but you want to be confident in how that's being maintained. Patient consent forms. I know we're running low on time, so very quickly touch on that. Legally speaking, they just have to be signed once. We at Abide recommend at least every 3 years, but most practices do it every year. And then just making sure anytime there's like a life-changing event, like if somebody goes from 17 to 18 or gets divorced or remarried, that's when they should be re-signed. But again, most practices just have a plan in place to do it yearly through their EMR systems. And so that's what we see a lot. Your HIPAA manuals where everything's being stored that I talked about. But now jumping into your business associate agreements. These are going to be legal agreements with all of the vendors who have access to your patient records. They're signed between both parties, you and them, from IT companies, consultants, EHR, third-party billing, telehealth, patient communication systems, some CPAs, some marketing agencies, anybody with 2 types of patient records that they're holding. Because if something happens on their company's end, this BAA is essentially a legal agreement protecting your business from that vendor's mistake. And so you want to make sure they're all signed, they're all stored in one area, and they're not expired. And if your BAA will not sign an agreement, move on. There's a lot of people that will. We work with, we have hundreds and hundreds of partners and practices. We've met with thousands of BAAs. They know what these are. They should sign them. If they don't, it's a big, big red flag. So we recommend, moving on from them and finding a company that will. And then, of course, updating everything each and every year minimally, especially that risk assessment. With you being a private, smaller practice, I would recommend making a game plan where it's monthly or quarterly, just doing a few action items each time. It's going to create a better culture of compliance for the business and hopefully less stress on your end. In regards to audit letters and investigations, like I mentioned, we haven't seen anybody come into a practice on our side. Everything's been done through mail or email or phone call. This is actually a smaller organization that received this letter in the mail because an office manager accidentally clicked CC instead of BCC on an email to about 400 patients. Just a simple mistake, but it was still a breach. And so they got audited for it. And as you can see here, what I've highlighted, they asked for a lot of documentation. They didn't ask for training certificates or patient consent forms. They wanted to see policies and the risk assessment. Now, jumping back to that safe harbor law, this practice was able to actually provide all that documentation to the government, and they just moved on. And so the big thing there and questions to consider is how are we going to get all that documentation in place? What are we going to do? When's the last time we've done something with HIPAA? Step one is creating a risk assessment. Step two, policies, of course, training the staff and checking on business associate agreements, and then having an action plan to actually maintain all that documentation for your local business. And then think about, if there was an audit, data breach, or complaint tomorrow, are you guys comfortable with that documentation you have, or is it time to look at something? And so that's another big reason why the HIPAA Journal has partnered with us. Not going to take you guys through a demo today, but just so you can see what's out there. If you're sitting here like, what? When's the last time we've done anything for HIPAA? We have an industry-leading solution that meets all of your federal and state requirements and can be implemented within the matter of minutes. We have a solution that is able to actually dynamically generate all that documentation that you need, that full risk assessment, help you send out your business associate agreements, and then of course train the staff. And you have access to unrivaled support members that are there to help you out and complete all these tasks. But if that's something you're interested in, please let us know, and we're happy to set up some time. And so with that being said, I really want to thank everybody for joining today. You can see my email on the bottom there. That is also my direct line. Feel free to call, text, email me. And then if you want to set up some time to meet with me to ask me questions or get a sneak peek in regards to Abide solution so you guys can see how we can help your practice and how we currently help thousands of private practices just like you all around the country, go find some time and I'll be happy to connect and provide any guidance I can for you. I was going to say we got about 1 minute left. I don't see any questions in the chat box. And so with that, we'll leave this up for another 15 seconds and then I'll get everybody back to the rest of their day. I really appreciate you guys joining, and I really hope you guys were able to take at least one actionable piece out of today's meeting to implement at your practice or to at least cross-check to see how things were done in the past. Thank you guys.